Today we're going to be doing an arterial puncture to draw a blood gas on a patient. So the first thing that I'm going to do is review the patient's chart, look at the order, and make sure we have a reason to be doing the blood gas in the first place. And then I'm going to review the chart history and make sure the patient isn't on any anticoagulants or that they don't have any other reason that they shouldn't be sticking any certain arm, such as surgical history or something like that. And then I'm going to go to the patient's room, sterilize my hands as I enter, and make sure I put on my gloves. I'm going to introduce myself to the patient and tell them what I'm here to do. So, hello Mr. Jones, I'm Angela with Respiratory. I'm here to get a blood gas from you. We're going to be drawing some blood. And then I am going to feel for a pulse in their arm and make sure that I have the strong pulse and that it is a good arm to do it on. So I feel a strong pulse in this arm, so we're going to do our Allen's test to make sure they have adequate circulation. So we're going to occlude the radial and the ulnar arteries and have them make a fist, or in this case I'll make a fist for him. And then, so we're going to let it blanch, and then we're going to lift our hand off the ulnar artery and then open the hand back up and make sure that blood flow returns and it pinks up within 7 seconds. So it did, so we're good to go on this arm. So now we are going to sterilize the area with our alcohol swab here. Okay. So we're going to sterilize the area. And now while that's drying, we're going to get our needle ready, our syringe. Remove our cap. Okay, so now we're just going to feel and find our pulse. Make sure our bevel is facing upwards. Okay, so now you're going to feel a slight prick here, Mr. Jones. Okay, so we have our blood, so we're going to put pressure on it, remove our needle, cap it, and now we're going to hold pressure over it for about 5 minutes or until it stops bleeding. Get our lid out here. Take this part off and cap it. And then we're going to get the air out of the syringe. We don't have any air bubbles. And then we're going to rock and roll it to mix the heparin with the blood. So, rock and roll. And now we're going to check and make sure he's done bleeding. So it's been about 5 minutes or so he's all done, so we're good to go. And now we have our syringe, and we're going to label it and send it off to the lab, and then go and document and chart what we did.